Hi, I'm Dr. Anderson, past president of the AAP and a racing practitioner.
Okay, and we're here to do a workshop, veterinary truck inspection, that Dr. Anderson has agreed to do that, and she's one of our panelists at our Racing Officials Accreditation meeting in the first week of April. So Doc, why don't you show us what you got here?
All right, it's a basic work vehicle. Carry all the equipment as well as all the medications necessary to treat and diagnose any issues with performance horses. Don't hit your head. So, what would you like to do?
Well, why don't you show us where we should really look? If you were an investigator, okay, where would be the first place you'd look on a vet truck?
Well, I think the sort of, for me, the real question is, this is an inspection, which means you're just basically doing a top-down look at what we have in the vehicle.
Right. And
I have a very large amount of medication in my truck, and I took the liberty of bringing an inventory, and so there are 5 pages of medications that are on my routine inventory. Of those, I have highlighted and starred the ones that are the RMTC controlled therapeutic medications. And the point being that they are a very small component of the rest of my inventory. Right. But it's important, I believe, to be able to recognize those easily and to be able to know that those are legitimate, commonly used drugs. The rest of the medications have their place, but they may not be used as close to race time as these ones are.
Okay.
All right, so bottom line is, routine, you've got your basic equipment everywhere, all little nooks and crevices, there's little pieces, jugs are on the side. Typically I would be saying, they should be unopened and no indication that there's been any tampering. Obviously I have a locked drawer there, that would be my DEA drawer, and in that would be my DEA medications. DEA are controlled by the federal law, and in the locked drawer I have a locked box for the euthanasia solution. I also have Torbagesic, which is a DEA medication. That's pretty much the extent of my controlled drugs in this truck. However, if I was looking as an investigator, I would say, okay, can you show me what's in that locked box? Mm-hmm. So I can pull that out right now. It's kind of a beat up locked box. So.
Okay. Well, we don't want to look at your combinations.
No, please don't. Alrighty, so there it goes. And in here we have euthanasia solution, ready syringes, succinylcholine, which is how I happen to, and a large gauge needle, so I can respond immediately to a catastrophic injury. And so that's that. As far as the rest of the medications go, they are a combination of oral with the Regimate or injectable. I think most veterinarians organize their medications a little bit by either use or withdrawals. And so in this drawer I have primarily antibiotics, Baytril, Oxytet, Genacin. I also have Banamine, because this is the only drawer that'll hold tall bottles. And Banamine is flufenazine, and this would be a great example of a generic brand. Banamine is the brand name, and it will have a NADA number, which we're going to discuss later, and this will have an ANAD number, which is an abbreviated number because this is a generic. And I think, where is that number? Let's see if we can see it here somewhere. I have a picture of it later. Not sure. I'll have to look for that. Alright, you better edit that out. Next drawer is going to be primarily, in my practice, topicals and different kinds. And basically I would be suggesting that you want to kind of dig around and make sure that there's nothing at the bottom, just like when you go through the TSA in the airport. They pull things out and kind of peek around.
Sure. In
the back we have my dosed stuff, which is by syringe, so this will be phenylbutazone. And then I would have Fulvicin for skin disease, and Banamine for colics, and Biosponge for colics or diarrheas. So every product in here has a purpose, and they're all labeled not only on the product, but also on the end, so that I can identify and pull them out easily. No, I can't put it in this way. There we go.
There we go.
Another thing of interest would be these boxes here. So these are going to be mesotherapy. So I do mesotherapy, and these are all the little needles and the
Well, explain that.
IV set. So this is going to be a very sub-Q injection series with a needle on each one of these little spots, and I would do it on a grid pattern on a horse with a sore back.
Wow.
Typically using either a vitamin or sometimes a Serapin paste.
But all legal things for a veterinarian, practicing veterinarian to have.
Yes, and you know, that's a therapeutic approach.
Okay.
I think the other thing is U-brews. So these are made up by our practice for horses in our practice. This is a throat spray, and the ingredients are listed on the bottle. And then when we dispense it, we will put the name of the vet, the horse, and what our treatment recommendation is.
Okay, great.
I mean, obviously we have lots of those shampoos. In my top drawer, I have, this is what I would consider to be more the products that you're likely to see being used within the 7 days prior to racing. So phenylbutazone being one of them. And estrone is typically used for stifle issues in advance of racing. Amicar we use for breezers as an adjunct for horses that are bleeders. Now over here I have on tranquilizers all in a row. Acepromazine is commonly used for training purposes, not for racing purposes. We have also got oral acepromazine and Dermosidan, another common product for short-term tranquilizer. You can go a little closer for horses that tie up. Ketofen, 48 hours. What else do we have here? Dex, 72 hours typically. Osphos is a biphosphonate used for subchondral bone bruising. So as you can see in this one's Soludelta is used for horses that are having anaphylactic shock. Alright. Another top drawer. And this is going to be more ophthalmics, or in this corner right here. So eye ointments, some emergency trach tube, that type of thing, scalpel blades, clippers all the way back. It's just odds and ends, thermometers. And then I also have a suture set. It should be in here. I can sew everybody back together. And then within that, obviously it would be important to poke through, make sure that it is primarily suture materials, drains, catheters, all the kinds of things that go. I think I also have my microchipping stuff in there. And then in here would be our culture setup or IV set. So this is an IV set, and then I also have the ability to do cultures through the scope for a respiratory disease. All right, another top drawer. This is more routine vitamins. So one of the things you'd be checking on here would be vitamin B12. You look for the date on it's 3/17, so that just makes it right now. But if you look at the date on this one, it's 5/16. So this is an expired product.
So that would be something we may confiscate.
Exactly.
Okay.
And that would be, you know, one of those ones where obviously it went under my radar.
Now I've talked to other vets, and they said, well, you know, they have horses too, and sometimes they would use expired medications on their horse. Is that?
I think that that's an individual choice. As an owner, you can do that,
but not for a client.
Correct.
All right.
Yeah. Lasix, commonly used product for breezing and for racing.
Okay.
What else do I have here? Vitamin C. Again, I have a panel of vitamins here. Typically, we have got a series on some of these horses that don't eat well or post-race. And again, an expired product.
Okay.
All right, so you can see they're easy to identify. They're vitamins. They are generic. They do not have an NADA number on them, but they do have an expiry date, and that's the thing to know.
All right.
Intra-articular medication, betamethasone.
Okay.
And it is on the list of therapeutic medications. It also has an NADA number on it, and it should have an expiry, 2018.
And NADA stands for?
The federally approved number.
Okay.
Original product. Carbocaine, used for lots of diagnostic blocks.
Okay.
Prednisolone, used again for soft tissue inflammation, on our list of RMTC products.
Okay.
Iodide in almond oil, internal blister, commonly used on stifle problems. It is a compounded product. It has got an expiration date on it, which is 2017, so we're right on the cusp there. And it is for office use only. Okay. If you look at this label, you'll see that it is illegal, well, to dispense this bottle as a whole, but rather to use it on the patient would be fine. And what else do we have back here? Another product, which is Trihist and triple. So this is an antihistamine for horses that are having hives or respiratory distress as a result of airway inflammation. And this is
for all the folks here at home. Wedgwood Pharmacy. Do you do you get a lot of stuff from Wedgwood?
We do a lot of work with Wedgwood, yes.
Okay.
And this is valid for another 6 months.
Okay.
Interestingly, vials can also have an expiration date on them. And so here we are, 2018.
Is that because they have heparin in it or something?
Because there is a quality assurance program. Okay. In order for them to be able to assure you that their lab values are correct, you need to use current tubes.
Okay.
And then we get to the oral medication drawer, and in here I have dose syringes, and I think it's important to know that a dose syringe has a catheter tip on it, and it is different from an injectable syringe, which I'll show you right now. So you can see the difference between these two tips. Very important.
Yes.
So if you see one of these, this is legit for having around the barn, and this is on the racetrack not legit.
Right.
All right, so we put those back where they belong. So, antibiotics, again, expiration dates. ANADA means this is a generic product, but legal, approved by the FDA. Broad spectrum antibiotic.
What would you use thyroxine powder for?
I use that for horses with low thyroids, and we do that by pulling the blood work to establish that. Typically, they are not doing well. They have poor hair coats. Lots of times they are prone to tying up, that type of thing.
There was a rumor going around a couple of years ago that levothyroxine, is that the same thing as thyroxine? Or?
It is. There's a variation of thyroid supplements. I'm not really sure. That
some trainers were feeding it because they were also giving cobalt chloride at the same time?
I can't speak to that because I don't know anybody who was doing that, but certainly thyroid has a very valuable place in treating performance horses because they're under stress.
Right.
Chloramphenicol, another antibiotic. Again, you kind of just peeking to see. You should always be able to see there's an expiration right there. It looks like one other thing you might consider doing would be saying, did I just break the seal on that? Is there anything inside? That would be something. If you wanted to get really excited about something, I'm just looking to see if there's anything here. There you go.
Sure. Okay.
Different products have different seals. GastroGuard. I only carry a very limited amount because this is very expensive. It's $40 a tube. So this will get me a patient started, and then I can go back and dispense them a larger volume. This is on your list of RMTC products. Aspirin powder, we'll commonly use this for horses that are bleeders or for horses that have eye problems. Rebalance is a generic, legal, FDA-approved treatment for EPM. And again, expiration on it, and again labeled, so that when we dispense these oral products, we put the name, the horse, and the dosage on it.
And for the people that are at our conference, EPM stands for?
Equine protozoal myelitis, which is a neurologic disease that we relatively commonly found in young racehorses. And this is an alternative treatment. So this would run you about $150, $200 a bottle, which would last you 30 days. And this would run you about $200 a tube, which would last you a week. So there's a big difference, and that's why we have two choices, because we have people with different budgets. Equiox, again, an RMTC therapeutic medication, and it's available in tablet form as well as paste. Typically I'll use the paste, and it's an anti-inflammatory with less gastric ulcer side effects. Doxycycline, common antibiotic for Lyme's disease, and as a broad spectrum antibiotic for respiratory disease or bone disease, sinuses, that type of thing. So there's, as you can see, a large number of products here. Hydroxyzine, another antihistamine for horses that have chronic hives. So you look through, you say, well, everything in here, A is the expired dates look fine, and the products appear to be untampered with and pretty much in line with the standard vehicle. All right, as we looked at earlier, there's a syringe drawer. Certainly, you know, if you were investigating from a truck inspection, I'd be taking a rifle through and just kind of making sure that you don't see any products stashed down the bottom, which we don't. And you say, well, what do you have this little empty jar for? Not sure. Thermometers, syringes. Again, you kind of just look through, just like the TSA. Middle drawer, some bandaging gear, more oral. I keep the Asium in this drawer.
Sounds like we got some background music here. Hold on one second. Okay.
Gotta have that music.
Yeah.
Asium and Nocazone paste are both, in my opinion, high risk for positives if they're inadvertently administered, so I keep them in a separate drawer, so it's a conscious decision.
Okay.
Obviously, we have lots of bandaging materials in here, and again, you know, you kind of want to look through, see if there's anything here. Staplers for wounds, urine cups.
Yeah, so anything that looks out of place you really want to be looking for.
Yeah.
Okay.
Fecal cups, just in case you want one. All right, ophthalmoscope. So you just want to open that up, take a peek. Yep, looks like an ophthalmoscope.
Yep.
And then it's okay, what about all these other little goodies? Suture material. Okay, so that's going to be for your quick sew jobs. And then what's in here? Aha! Just needles and syringes.
Okay.
Typically I'll use that with some acupuncture.
Okay.
And then some spare needles for when I inadvertently run out. So those are those. And then in the center drawer down here would be, again, sort of routine things. Bucket scrub. One just look in there. Trash can. Sometimes it's good to look in the trash. What's this? Oh, chorionic gonadotropin to knock fillies out of heat when they're in heat. So that was used this morning. These are all pretty much wormers, with a spare bottle of chlorhexidine scrub for the horses that are allergic to betadine scrub.
Okay.
And betadine solution. Nothing very exciting in here. Cotton. You obviously want to take a poke around. Nothing exciting in there. And that look at that. Alright, so to me that would be kind of an overview of the truck contents. And then I would probably be saying, okay, so is there anything looking amiss? And I'd say, well, what's this little container for?
Right.
And I'd say, I wonder what this little plastic bag is. And then I would pull that out and say, expired Rompan. Anyhow, the point is that it shouldn't really be in the drawer. It should not be in the truck.
It should be in there.
So, well, if it's expired, it should not even be in the truck.
Right.
But I placed it here as an example of an obvious
hiding place.
That, you know, you really ought to be just taking a peek, because there ought not to be anything there. Some
vehicles have a loose fitting thing here where you can flip this up. And,
so that's a very good point. Plastic. So we'd say, what's this for? Okay. And underneath that, we would pull
there you go. Got you, Doc.
Yep, an empty vial.
Okay.
But perfect location for storing stuff. The only hard part is getting it back out.
Right, right.
Which is why I put the bag on there.
Sure.
And then, obviously, you want to look underneath. And trays. So you can see that.
Oh, you got something in there.
Got something in there, yep.
Oh, yeah.
It's a labeled syringe
for
a horse that I'm treating later this afternoon.
Okay.
And then we can go further back.
Oh, yeah.
So, okay, you got a bag of stuff. What's
all
in
kinds
here?
of goodies in there.
All right, there's all the electrolytes. And you want to just take look through and say, okay, that looks legit. Oral electrolytes, and you can look from here and say, all right.
You always should have a flashlight with you too.
Yep, and that's why we have this handy dandy light right here. And you could slide that right in there. But you're correct, you don't want to see. So there you go. So you say, well, I better go look up there. So off we go. Is this going all right?
Yep.
Good. All right, so the side door, you got the cooler. You want to look in the cooler. Say, okay, well, here's an open bottle of procaine penicillin.
Okay.
Again, that's got a withdrawal date.
I think I'm going to come around the other side.
Okay. Alright, so then it's a plastic bag, high visc, common hyaluronic acid. Check the expiration dates. This is intra-articular medication, 2018. Adequan, very common medication. Legend, another common medication. So those look pretty legit. You could say, should I open one of these little boxes and be sure? That'll be fine. And again, make sure that everything is labeled. As you can see, and you look in, and sure enough, it's a bottle of Adequan.
There you go.
Just like it's supposed to be. And then you'd say, okay, what about these little plastic containers here? What's in those? And you just looking at the top of this, you'd be saying, looks like vaccines. And sure enough, they are. And so you have different kinds of vaccines. Expiration dates on these are very important, and the fact that they need to be kept cool is important. So again, that's a quality issue.
That's why you have them in the cooler.
That's why I have them in the cooler. And I have this other little box here. What's in here? This is an open and in use box. So X-Stim, immune stimulant, Adequan, ACTH, commonly used for the same horses that have the low thyroids. This will help stimulate. And then an intra-articular box. And this will have my intra-articular Pre-Def, intra-articular Adequan, that type of thing. So pretty much everything looks above board. And then you'd say, okay, what about behind the seat? So on your side, you can just flip that seat forward. Right there should be a lever. And then just pull on it. Can you do that?
I don't have a free hand.
Okay, you pull.
There we go. No.
Not happening. Okay. All right, let me come around.
There we go. I got it. Oh, here we go. Okay, so.
Right, so looking in there, you can look how tough it is.
All right.
Well, nobody wants to really check the oil out, so you can see that that's oil. You've got an emergency splint, complete with bandaging set up there. That leaking oil tank. Behind that, you have alcohol, Epsom salts, and nothing else appears to be on the ground here. You can look down underneath with your flashlight if you had one.
Right.
Or you could move that splint and just kind of look forwards.
Sure.
And that would give you a look at that. And then over here, you're going to be looking down and around. And you want to look underneath with the radiology too.
Sure. Now, do you have your shockwave therapy in your vehicle, or do you keep that at the office?
Keep it at the office, and it's too big to pack around. Yeah. So, again, I'd be saying, okay, what's this underneath the cooler? And then you pull it out.
Okay.
Underneath the cooler is a good spot to put things. Scope case.
Right.
Should contain your scope. Typically, these things are pressure loaded, so you have to have them right side up to get them open. So if you can't get it open, that's what it is.
I see.
It's kind of a little trick. And then you look in here, it's okay. All right. Catheters, batteries. That looks fine. And wipes.
Okay.
Scope. Catheter with cleaner.
And this is to check down the horse's nasal cavity, right?
Yep.
See if he's bleeding or.
Yep.
Okay, we're going to take a break here, Doc, because we're down to 1 minute on film. Okay, we're back online.
Okay, so anything that is a container is, in my opinion, ought to have a quick peek. And as you can see, this is where the tubes live. Pretty straightforward. And down here, as you can see, we have a lot of radiology.
Now, some of these trucks actually have compartments underneath the floorboards. Yours doesn't.
Yeah, mine doesn't.
It doesn't,
I wish it did.
But some do.
Yeah, they probably do. So, looking in there, you could certainly pull out all the aprons, but
Sure.
bottom line is,
Yeah.
you won't find anything.
Doc, we know you're honest.
But
So
here is a bag. So what's
Right.
in the bag? And again, that'll be your shoeing
your
tools.
tools. Okay.
And
All right.
you could go down, just pat them down, make sure that's all that's in there.
Sure.
And something's in here.
Ah.
For abscesses.
Okay.
Okay. Cut out some of this stuff, I hope. So that's kind of it for the back of the truck. Yeah, I'll put it all back together in a minute. So obviously, just like any other vehicle,
Sure.
you know, you would just go forwards and look underneath the seat,
Sure.
look in the glove box,
Right.
look in the console, look above the stuff,
Right.
and look in the doors, and
Yeah, you want to make sure that the panels are fastened, and
just routine.
any little hiding places that they could find.
But I think the bottom line being that if everything in the back sort of checks out,
Right.
you're probably not going to find
That's
anything
right.
somewhere else.
Yeah, we're not doing a trainer's truck. We're doing a vet. You know.
Yeah. I mean,
we expect to find these
you
things.
expect to find a whole lot of
Right.
stuff in a vet's truck.
Sure.
And for the most part, with the exception of expiration dates, it should all be pretty much above board.
Would there be any reason for a practicing veterinarian to have something like snake venom or something like that?
No, obviously not.
Okay, so
No.
so that would be a red flag right there.
Well,
So.
yeah, and I can't imagine.
And that comes in powder,
Finding that.
doesn't it? Usually come in powder. And
No idea.
Yeah.
Never seen it.
Okay. Right. All right.
Okay.
So this is very, very informative, Doc.
Does that help?
Yes. Thank you for taking the time to do this with us.
Yeah. So if you take these notes.
All right.
And I probably don't want this published, but you can
Sure.
flash a picture of it just to show, you know, the things that are
Right.
highlighted.
Yes.
And then you already have this.
Right.
But the point is, this stuff should correlate with that. And I just think investigators ought to know this stuff.
Sure.
This is
Right.
you know, therapeutic medication that's going to show up in horses.
Right.
And you ought to see it in the trucks.
Sure.
And if you saw something that was, you know, the truck that didn't have a lot of these medications, it would beg the question. So, what are they actually doing here?
They're, I've been around, Doc, for many years, and one of the veterinarians that we did an inspection on, he used to put little red dots on his bottles,
Yep.
and that was a red flag to me. And then we would take those bottles and we would confiscate those bottles to
Okay.
determine if it was actually
Really?
the stuff that
So
was
what
in
was
it. It was Cialis.
Okay.
So.
So I guess I would be not surprised to see little red dots because a lot of people have different inventory systems.
Right.
So to me, red dots could mean respiratory drugs,
Right.
or it could mean due to expire in
Sure.
December.
Right.
So there's any kind of codes that it could mean.
Right.
to, you have to kind of think outside of the box to recognize that it could be a problem too.
Right.
All
Okay.
right.
Anything else? No, I think you covered it all.
Okay.
Very good.
Well, I hope you can sort of rip that thing to bits and put it into a one piece.
Yes. Yeah, we can edit it and put it all together. Okay, we're ready to go. So, Dr. Anderson, how'd you get started in veterinary medicine?
Well, I worked with horses before I went to vet school, so it was pretty much a straight run. But I grew up in British Columbia, Canada. I worked with event horses initially, and when I went to vet school, I started galloping racehorses and became totally enamored with the sport. I graduated in Saskatoon, Saskatchewan, and went to school right off the bat, or went to work right off the bat at Suffolk Downs in Boston, Massachusetts in 1986. I worked with a very good veterinarian there, Dr. Martin Simonson. And as the economy unraveled in New England, I've just migrated south and landed at Fairhill in 1992. So I've been involved with racing my entire career.
And they got quite a few horses out of Fairhill, don't they?
We have about 700 during the high season and about 350 in the winter.
Right. And you have some Hall of Fame trainers stabled out there too.
We do.
Yeah.
Several of them. And, more importantly, we got some great horses.
Yeah, that's great. Fairhill's a great place. It's the home of the TRPB and the TRA and the National Steeplechase Association. So it's great, and the park there is just beautiful. I've been there many times.
We're in the process of trying to upgrade the turf course, which, if we can get it done, would be terrific. So that's coming down the pike.
Did you ever practice at Marquis Downs or Assiniboia or any of those tracks?
Well, that's where Marquis Downs is where I started out galloping. So I didn't practice there because I was a student. But
I spent a lot of time up there.
Okay.
All right. Thanks, Doc.
Thank you.
Okay.